Did you know that your feet can be a window into your overall health, particularly regarding diabetes? Imagine if your feet could speak. What would they tell you about your well-being? From subtle sensations to visible signs, the condition of your feet can offer crucial insights into the presence and management of diabetes. In the case of diabetes, a condition characterized by elevated blood sugar levels, the feet can provide valuable clues long before other symptoms manifest elsewhere in the body. From tingling sensations to changes in skin texture, the feet may whisper warnings of nerve in simple terms. It means harm caused by being exposed to high levels of sugar in the body for a long time. Picture this. Your feet may feel oddly numb or tingly sensations, indicative of peripheral neuropathy, a common complication of diabetes where nerve function deteriorates. This numbing effect can dull your ability to perceive pain, making it easy to miss the early signs of injury or infection such as cuts, blisters, or ulcers. Now let's explore how understanding the foot's sign language can empower you to take proactive steps toward better health. Sign number 1, numbness or tingling sensation. Diabetic neuropathy is nerve damage resulting from prolonged high blood sugar levels in diabetes. It encompasses various types, each affecting different nerves and causing distinct symptoms. Peripheral neuropathy, the most common form, leads to numbness, tingling, and pain in the limbs, especially the feet and legs. Autonomic neuropathy affects involuntary bodily functions like digestion and heart rate, manifesting in issues like digestive problems and orthostatic hypotension. Proximal neuropathy targets nerves in the thighs, hips, and buttocks, causing severe pain and weakness. Focal neuropathy causes sudden localized symptoms such as muscle weakness or paralysis. Management focuses on blood sugar control through medication, diet, lifestyle adjustments, symptom alleviation, and preventive measures to curb further nerve damage and complications. Diabetic neuropathy underscores the importance of proactive diabetes management to preserve nerve function and overall well-being. Sign number 2, edema. Edema in diabetes is the swelling caused by fluid accumulation, primarily affecting the legs, ankles, and feet. This condition arises due to several diabetes-related factors, including damage to blood vessels and impaired circulation, which can lead to tissue fluid retention. Kidney dysfunction, a common complication of diabetes, reduces the kidney's ability to filter excess fluid, contributing to edema. Certain diabetes medications, such as insulin or thiazolidinediones, may exacerbate fluid retention as a side effect. Heart disease, often coexisting with diabetes, can further exacerbate edema by causing fluid buildup in the body, particularly in cases of heart failure. Peripheral neuropathy, another diabetes complication, may also play a role by disrupting nerve function related to blood vessel regulation and fluid balance. Management of diabetic edema involves addressing its underlying causes, such as improving blood sugar control. Monitoring for signs of edema and seeking medical advice promptly is crucial for individuals with diabetes to prevent complications and ensure optimal health. Sign number 3, slow healing. Diabetes disrupts the intricate interplay of cellular and molecular mechanisms in wound healing, particularly in the lower extremities where blood flow and nerve function are often compromised. Elevated blood sugar levels, which are typical of diabetes, may damage blood vessels, impair circulation, and make less oxygen and nutrients reach tissues essential for healing. Additionally, diabetes-induced neuropathy or nerve damage can diminish sensation in the feet, making individuals less likely to notice injuries or wounds. Consequently, sores, minor cuts, blisters, or abrasions may go unnoticed and untreated, escalating into more severe ulcers or infections. Furthermore, diabetes disrupts the inflammatory response, a crucial early stage of wound healing, further delaying the process. The weakened immune function in diabetes exacerbates this issue, making individuals more susceptible to infections that can impede healing and lead to chronic complications. If you found this video informative, subscribe for additional insights and updates about diabetes. Sign number 4, changes in texture. Diabetes-induced alterations in the texture of the feet are common manifestations of the condition's impact on skin health. Elevated sugar levels in the bloodstream may result in various changes, including dryness and cracking of the skin, a consequence of impaired hydration due to increased fluid loss and decreased sweat gland function. This dryness predisposes individuals to skin breakdown and infection, particularly in weight-bearing areas like the heels. Additionally, diabetes-induced neuropathy can disrupt sweat gland activity, decreasing sweating and exacerbating dry skin. Furthermore, compromised circulation in diabetes can lead to tissue ischemia, manifesting as a shiny, smooth appearance of the skin. These changes underscore the importance of proactive foot care measures, such as regular moisturization, hydration, and foot examinations, to prevent complications like ulcers and infections. By addressing these skin changes promptly, people with diabetes can reduce the chance of foot-related issues and keep their feet healthy. Number 5, poor circulation. Experiencing cold feet can be a subtle yet significant symptom of diabetes, primarily linked to poor circulation. Elevated sugar levels in diabetes may cause harm, both blood vessels and nerves, reducing blood flow, especially to the feet. This impaired circulation results in a cold sensation. Additionally, diabetic neuropathy alters temperature perception, making feet feel cold even when they're not. Recognizing and addressing this symptom is crucial, as it reflects the health of the circulatory and nervous systems. Effective diabetes management, including blood sugar control, regular exercise, and foot care, can improve circulation and alleviate these sensations. Understanding the significance of cold feet underscores the importance of holistic diabetes management for overall well-being, and highlights the need for proactive measures to maintain foot health. Number 6, change in skin color. Changes in skin color on the feet, such as red, blue, or pale hues, serve as visual indicators of underlying diabetic complications. These changes are primarily attributed to poor blood circulation, a common issue in diabetes due to blood vessels that have been harmed due to elevated levels of sugar in the blood. Compromised circulation affects the supply of oxygen and nutrients to the skin, resulting in noticeable color shifts. For instance, a bluish tint may indicate reduced oxygenation, while redness could signal inflammation or infection. These color changes are not merely superficial, they offer insights into the vascular health of individuals with diabetes. It is essential to identify and address these changes promptly, involving maintaining blood sugar levels within a healthy range and seeking medical advice for persistent alterations. This knowledge underscores the importance of regular foot checks and comprehensive diabetes management to prevent severe complications and promote overall well-being. Number 7, loss of hair. Losing hair on the toes and lower legs can signify diabetes-related complications, often linked to poor blood circulation. High blood sugar levels damage blood vessels, reducing blood flow to the extremities like the feet and lower legs. Hair follicles rely on adequate blood supply for growth, but diminished circulation disrupts this process, leading to hair loss in these areas. This symptom isn't merely cosmetic. Number 8, peripheral artery disease, PAD. Pain experienced while walking, often overlooked, can be a critical indicator of diabetes-related complications. This discomfort, medically termed claudication, arises primarily from poor circulation, a frequent issue in diabetes because of the harmful impact of high blood sugar on blood vessels. This vascular impairment restricts blood flow, particularly to the legs and feet, leading to pain and cramps during physical activities like walking. It's not just an ordinary ache, it's a sign that the muscles aren't receiving enough oxygen-rich blood. Additionally, diabetic neuropathy can contribute to this pain by affecting nerve function in the legs and feet. Number 9, foot deformities. Foot deformities are common complications arising from untreated diabetic foot problems, posing significant challenges to mobility and overall foot health. One such deformity is hammer toes, where the toes become bent or curled due to muscle and tendon imbalances, often exacerbated by nerve damage from diabetes. Similarly, bunions may develop as the big toe deviates towards the second toe, causing a painful, bony bump on the joint. Diabetes-induced neuropathy can contribute to the development of these deformities by impairing sensation and altering gait patterns, leading to increased pressure and friction on specific areas of the foot. Furthermore, Charcot's foot presents a severe complication where the bones weaken and collapse due to neuropathy-induced loss of sensation and trauma. This condition can result in significant deformity and instability of the foot, leading to difficulties in walking and an increased risk of foot ulcers and infections. Preventing foot deformities in diabetes requires proactive measures such as regular foot exams, proper footwear, foot hygiene, and maintaining optimal blood sugar control. Early detection and intervention are crucial to mitigate the progression of deformities and prevent associated complications, emphasizing the importance of comprehensive foot care in diabetes management. Number 10, infections. Infections represent a significant risk for individuals with diabetes due to the condition's detrimental effects on the immune system. Diabetes compromises the body's ability to fend off pathogens effectively, leaving individuals more susceptible to infections, particularly in areas prone to injury such as the feet. Foot infections are a common concern, especially in the presence of open wounds or ulcers, a frequent complication of diabetes. These wounds provide an entry point for bacteria, increasing the risk of infection. If left untreated, foot infections can escalate rapidly, leading to severe complications such as cellulitis, a bacterial skin infection that can spread to deeper tissues, and osteomyelitis, an infection of the bone. Cellulitis can cause redness, warmth, swelling, and tenderness in the affected area, with the potential for systemic symptoms like fever and chills. The consequences of untreated foot infections in diabetes can be severe, potentially resulting in prolonged hospitalization, antibiotic therapy, surgical intervention, or in extreme cases, amputation. Preventive measures such as proper foot hygiene, regular foot inspections, prompt treatment of wounds, and optimal blood sugar control are essential for reducing the risk of infections and their associated complications in individuals with diabetes. Sign number 11, foot ulcers. Foot ulcers represent a significant complication of diabetes, posing substantial risks for individuals' health and well-being. Persistent pressure or injury to the feet, combined with compromised circulation and sensation, standard features of diabetes, create a perfect storm for ulcer formation. Elevated levels of blood sugar can hinder the healing process of wounds, making individuals with diabetes particularly vulnerable to the development of foot ulcers. These ulcers typically form in areas subjected to repetitive trauma or pressure, such as the football or heel. As we've explored, diabetes can lead to a range of foot-related complications, from neuropathy to ulcers and beyond. Understanding these risks is essential for individuals managing diabetes, empowering them to take proactive steps toward foot health and overall well-being. Whether maintaining optimal blood sugar control, practicing regular foot inspections, or seeking timely medical attention, every action is crucial in preventing complications and preserving quality of life. Stay informed about diabetes and its related issues by subscribing to our channel and hit the notification button. Remember, knowledge is power when it comes to managing diabetes, and together we can navigate the challenges and triumphs of this condition. Thanks for watching, and see you in the following video.